Thirdly, I want to talk about septic shock. When coming upon somebody with septic shock, some of the signs and symptoms of sepsis are often nonspecific and include the following: fever, chills or rigors, confusion, anxiety, difficulty breathing, fatigue, and nausea and vomiting. When it comes to hemodynamic monitoring and findings, a central venous catheter should be placed in the internal jugular or subclavian vein that will allow administration of medication and provide multiple ports for rapid fluid administration, antibiotics, and vasopressors. If needed, it can also allow measurement of central venous pressure. The therapeutic approach, a CVP of 8 to 12 millimeters per mercury, a MAP of 65 to 90 torr, and a central venous oxygen saturation greater than or equal to 70% is ideal. Also want to do general bedside monitoring with a BP cuff, pulse oximeter, and an EKG monitoring. As far as pharmacology options to treat this, crystalloid solution, which is a normal saline, which is a solution of sodium chloride at 0.9% concentration, which is good for hydration in individuals with hypovolemia issues. And empiric antimicrobial therapy should be initiated early in patients experiencing septic shock, usually within 1 hour recognition of the shock. The selection of appropriate agents to use is based on the patient's underlying host of defenses, the potential sources of infection that they may have, and most likely culprit of the organism. In most cases, vancomycin or linezolid are used. These drugs fight bacteria in the intestines. It's also used to treat staphylococcus infections that can cause inflammation of the colon and in the small intestine. For mechanical ventilation and ABGs, most patients with sepsis develop respiratory distress and manifestations of severe sepsis or septic shock. These patients may need intubation and mechanical ventilation for optimal respiratory support. Intubation should be considered early in the course of progressing severe sepsis and septic shock. Given the increased work of breathing one may develop with septic shock, I potentially see them with a type of metabolic acidosis given the organ dysfunctions.